Jeffries. I'm one of the principal technology architects here in the New York MTC. My apologies to everybody for the slight delay in our session. We had a slight technical issue here, bit of a storm going down in New York and some excitement happening here as well. But we're on track and we'd like to welcome you to the modern healthcare experience with the Microsoft Cloud for Healthcare. As I said, my name's Stephen Jeffries, and joining me is Alex and Phil, colleagues who are also technical architects and part of our digital advisors team. They're going to be helping me and helping you go through the journey, taking on different roles. So as part of our journey, you'll see me act as a narrator, but as a doctor at the same time as well. Alex is going to be Nurse LaDonna, and Nurse LaDonna is going to be participating as parts of the clinical role. And you will see Phil take on the role of Roland, who will be our patient, and keep an eye out for the end, maybe even become an employee of Foster Memorial. You never know. We'll see how we go. So thank you very much to start off with. What we want to do is just share a couple of things with you. We're going to touch on the healthcare cloud, but the specific experiences that I want to share with you are going to be around the patient journey, our care team collaboration, and also how we can bring clinical staff together. If you have questions, post them in the chat. We will do our best to address them at the end, and we look forward to taking you on this journey. You've probably seen about the Microsoft Industry Clouds, where we focus on a platform of identity security and management and compliance, and then build the Microsoft platform technologies up with the first-party IP specifically built for healthcare, and then myriad of partner solutions that sit on top. Today, you're going to see work that's done by Nuance, Cloud DX, Teladoc, some of our great industry partners that are building amazing solutions on Azure, on the Microsoft Dynamics platform, leveraging Teams as ways of being able to connect together. The Microsoft Cloud for Healthcare really focuses in 4 key areas. Built on that platform of data and AI and security and compliance, we focus on being able to enhance that engagement with the patient by delivering insights and personalized care, being able to connect effectively with your patient. We work on building better clinician experiences, and you may have seen the acquisition of Nuance, where they've now joined the Microsoft family so that we can deliver better clinician experiences by taking advantage of some of the additional platforms and tools. We're also going to be able to work at empowering our healthcare teams to work together, whether it's through care plan coordination and collaboration, being able to work with our partners for patient monitoring, and then lastly, build on those clinical and operational insights, a vast amount of data that can be coming from IoT systems to be able to bring our patient data to life. So with this in mind, what I want to do is start you off with my day, how I actually do things. So I'm just going to switch over here. And by the way, we're delivering this today by using the power of the Surface Hub. And what I'm bringing up for you right now is my first kick into the day and how I have a look at things going on my PC. So I'm just going to sit down here, and you can see I also have a Surface Hub behind me, but I start off with my daily dashboard, which is actually telling me the state of my patients that I have in place and key indicators that I want to be able to work with. So for most hospitals and most healthcare organizations, things like readmission rates are things that we keep an eye on. And so I've been able to bring together data from multiple disparate data sources into the cloud for healthcare here. And I'm running analysis across the top of this that shows me that my pulmonology group actually has a higher admission rate than I want to have as my baseline. And so what I can actually do then is have a look at what the costs are that are associated with that, and even drill down into that department to see where the issues could be possibly lying, whether it be at a clinical issue rate or at one of our physician rates. So I can keep an eye on what's happening on my overall hospital organization effectively. At the same time, I also want to be able to see what's happening with my different teams. So when I come into my care coordination dashboard, one of the first things I can see here is where I have active care plans and how they're progressing. But I can also drop into a HEDIS dashboard as well to see how my care coordinators are working together, seeing where they're effective, and if we're running into issues in different areas. So we can actually work with each other to be able to provide the best possible experience and see how we're actually working as a team for delivery of services. Now, in my particular case, the other thing that I want to do is come into here and I'm going to have a look at some of the patients that I happen to be working with. One of the hardest things that we need to deal with is actually having a look at the patient from a 360-degree perspective. So as you can see here, I'm just following up on Casey, one of my patients. I can see straight away allergies and sensitivities and contact information here. But some of the really important things that, let's say, are coming not only from my healthcare record systems, but also coming from external systems as well, can be rolled and connected together here. So I can see things like clinical data that is actually flowing through into here. Conditions, and one of the most useful things from my perspective is a patient timeline, where I can have a look at the interactions that have been had, not only through myself, but through other physicians within the care team. The clinical timeline gives me the advantage of being able to see multiple activities that are occurring that are delivered as part of an overall care plan. So we can use the cloud for healthcare to bring these items together. Oh, I see I have a patient coming, but before I do that, I want to make sure that some customization that we built is available. We recently put in place a patient social detriment survey that is custom to us, and it allows us to extend our overall environment. But I can see my patients arriving. Come on in. So, your name is Roland, is that correct?
Hello, doctor. Yes, my name is Roland.
Okay, so Roland, I'm wondering if you don't object, but we use some technology here to help our interactions and just, provide some productivity. So do you mind if we record the sessions for a transcription?
Oh, I don't mind.
Excellent. So let me just kick that off. Just on my phone, which is amazing technology. So, hi there, Mr. Wacker. It's nice to meet you. What brings you in to see me today?
I kind of was walking along and I kind of tripped on the sidewalk and I bruised my shoulder, banged into it really badly.
New York City sidewalks, you gotta love those. So you tripped and you fell on the sidewalk. Can you give me a bit more detail about how that happened? Just a trip and a fall or a roll.
Oh, it was more of a trip and a fall. I banged my shoulder into the walk, and there was a bit of a tingling sensation in my hand. It's been sore for a couple of days now.
Okay. So tell me, when you fell, did you hear a cracking noise or a popping noise?
There was a little popping sound.
Okay. And you mentioned that you made your hand. Was there some numbness or was it tingling?
Oh, it was a little tingle, but it's gone away.
Okay. Okay. That's good. About how long ago did this happen?
About 2 days ago.
So 2 days ago. Excellent. Okay. Since then, though, has your pain been getting better? Has it been getting worse?
It's been the same the last couple of days. Hasn't gotten worse. The first day was pretty bad, but now it's about the same.
Okay. Well, that's. I suppose that's good to hear in some respects. Okay. So I just to give me some context here, would you rate your pain, if it's a 0 being no pain and 10 being the worst pain you can imagine? Where would you rate your pain?
Well, right now it's about a 4.
Okay, about a 4 there. And have you done anything to help with this pain?
I put ice on it, and that's about it.
Okay, so if you put some ice on there. Any medications? Did you take any medications?
No, I didn't take any meds. That's why I came in.
Okay, that's good. That's good. Any other symptoms you may have noticed there?
No, not that I can think of.
Okay. How is it feeling in the morning?
Oh, when I get it in the morning, the shoulder's very stiff, but throughout the day, it's kind of warms up and gets a little more, useful.
Okay. Any other medical history that we should know about or issues?
Not currently.
Okay. What about medications? Are you taking anything currently from a medication perspective?
I take my daily aspirin.
Excellent. Okay, that's good to hear. What about allergies?
Penicillin is an allergy.
Okay. So you have an allergy to penicillin there. Okay, Roland, what I want to do is I want to do a bit of an examination on you here. So give me 1 second. I'm just going to do the right thing here and get ready to do this. So in terms of your shoulder, gotta love it when you rip the first one in place there. So let me just try that one more time. Running around here today, going insane. So pull those ones on. That'll do me for the time being. So what I want to do is I'm just going to come into here, and if you don't mind, I'm just touch your shoulder and just see if we can figure out where some of the pain is that's associated with that. Okay, so I'm going to just push here on the front here. How's that feeling?
Ow.
Oh, okay. So we have some tenderness on the anterior aspect of the shoulder. So if I push to the side here.
That hurts too.
Okay, so a bit of pain on the side. So that's tenderness to our lateral aspect. Okay, and lastly, what I want to do here is I'm just going to pull forward from the back.
That hurts also.
Okay, so we have tenderness to the posterior aspect of the shoulder. Okay, that's good to know here. So I want you to do something with me. Can you lift your hands up like this for me? And can you turn your hand over like that? Okay. So are we experiencing some pain there?
Oh yes.
Okay, so we have some pain on occipation, and if you turn your hand this way.
Yeah, that hurts too.
Okay, so we have some pain on pronation as well. Okay. Well, what I think we're going to be able to do here is have a look at this. So I've reviewed your shoulder x-ray and it looked good. Normal joint spacing and bone alignment, which is a good thing, okay? But with your story, the x-ray and the physical exam, the findings I'm going to diagnose you with is a right shoulder impact, okay? So what are we going to do to get this sorted out for you so you can get working? I'd like to do a few things to help you get better. First, let's do a sling so that you get some comfort while this heals. Nurse LaDonna is going to arrange for that for you afterwards, okay? I also want you to start and keep on icing the shoulder for 20 minutes, 2 times a day for the next 5 days.
Okay.
I'm also going to prescribe you some Loxicam 15 mg, okay? Take it once a day. It's going to help with the inflammation and the pain. I'd like to have you come back though and see me in 2 weeks if you're not feeling any better. And we can talk about maybe getting an MRI or maybe getting some physical therapy involved here if we need to. Now, here's the thing though. If you experience any further pain, come into any of the facilities at Foster Memorial. We can look at you. We can reach out and connect as well. So, even if you're not able to come back to here, okay?
Okay.
So do you have any further questions for me?
No.
Excellent. Well, that sounds good. I will make arrangements for Nurse LaDonna to get a sling onto you, and we'll go forward from there.
Thank you, doctor.
Great meeting you. Have a wonderful afternoon. Excellent. So as you can see, we were able to come together and have an interaction. Now, it's not the perfect interaction, and of course, I broke one of my gloves in all of that, but what actually was happening at the same time is we were using the capabilities of Nuance DAX. DAX is an amazing technology that we recently acquired, and as you can see down the bottom here, we actually took the interaction between the two of us, and we've been able to take through all of the information about the interaction. We know that he takes aspirin daily and generates penicillin. And what we've captured here is an encounter definition. The encounter with the right shoulder, the results of what we actually had sitting inside of here from our x-ray and the contusion that we have sitting in place, and what our plan for support is as we want to be able to move forward. So taking advantage of the power of a simple app on an iPhone, the power of AI and the Microsoft Cloud for healthcare, we're able to bring together and enhance the productivity of clinicians so that they can bring better result sets. But unfortunately, things haven't gone perfectly, and I believe we need to turn to one of our clinics with Roland.
Okay, so a few days passed and Roland scheduled a follow-up visits, but in a clinic that is much closer to his house than where the doctor is. But no problem. Hello, Roland. How are
Hello,
you?
nurse.
What seems to be the problem?
It seems to not have been improved much, so I wanted to ask the doctor about what I can do.
Okay, great. Well, I'm going to look if doctor's available. In the meantime, if you don't mind signing your name and the release agreement, and we'll check the availability of the doctor and see if he can join you remotely in a few minutes.
Thank you.
Let me go check.
So as you can see, I'm filling out the patient consent form, and now waiting for my consultation to begin.
Okay, so as the doctor, I'm actually on call today, and sitting inside of Teams is where we leverage TeleDoc. This is the solo capability from TeleDoc, and I can see here that I actually have a patient waiting in the waiting room. I can pop into here straight away, and I can go and have a look and see that, okay, well, we have a consent for care sitting in place here. So I can see the documents that are relevant for care, and I can see that he signed that, so that's good. I can even come into here and I can get additional information and connect. But what I'm going to do now is I'm going to connect inside of Microsoft Teams to be able to talk with my patient. So we're now opening up the call, and we'll be able to see each other inside of there. Roland, great to see you again. How are you feeling at the moment?
Hello, doctor. I've been taking the meds and I did the ice. It's it's kind of improving, but the question I had is that the meds seem to make my heart rate kind of really jumpy. Sometimes it's really too fast, sometimes it's really too slow. It just jumps all over the place.
Okay, that's interesting, Roland. So you know what I'm thinking I might do here? I want to reach out and let's say we turn on some home monitoring here. I'm not seeing anything unusual or untoward there, but I can kind of make an arrangement to send you a kit that will allow us to monitor your SpO2 and your blood pressure, and that way we can just make sure that everything's on track. I'll reach out to one of our team, and one of the nurses will make an appointment with you to go through how to do the reading on a regular basis. I think we want to look at doing this probably every morning and afternoon. Now, the partner we're working with, a company called PlantyX, so that you know, but they run a whole heap of AI and information across the top, so it will keep on monitoring. And if you want to take a reading at any time, you can. But we'll set up with the nurse to actually get the call moving forward here. So because I have to admit, I'm just sort of having a quick look here, and you're looking fairly good at this point in time. I'm not seeing anything unusual, but I want you to do me a favor. Can you raise your shoulder up and down like this for me? How's that going?
Oh, yeah, I can do that.
So it looks like you've got a little bit more flexibility going there as well.
Yes.
Excellent. Okay, well, what I'm going to do here is I'm just going to reach out to my home monitor here, and I'm going to see if we can get you that sorted out, and then you'll be able to go from there.
Thanks, Doc.
Excellent. So have a great day there, Roland, and I will speak to you a bit later on. Okay, so let me get the home monitoring sorted out here. And we've used Power Automate to set this up. So I'm just going to make arrangements to have the home monitoring configured. And we found our patient. And yes, I want to actually get that up and running there. And it's now going to start the ordering process, send a message through to LaDonna, who's going to get that up and going now. So now that we have this all sorted out, what I now want to do is hand across to the amazing nurse LaDonna, who's going to get things underway.
Okay. Let me connect my display. you know the there we go.
41759745.
Just want to project my screen so you can see. Give me a second. We have a totally new setup.
You got to click on. There we go.
Okay, so as you can see from the doctor's perspective, Stephen in this case, when he set up the order for the home kit, I received the notifications for sending it to the stations, and as a nurse, I have processed this notification and sent the kit to Roland. Also, as a follow-up, I scheduled a few different appointments. Again, same I'm working in Microsoft Teams, and I have the ability to schedule and see patient information directly in Microsoft Teams. I'm going to schedule a follow-up in-home visit with Roland. And I have access to the records and information that I have from the patient. I'm going to schedule it as a follow-up in-home visit. And we do have the email address that is registered for Roland. He gave us the email address when he came in. So no more phone calls from unknown number. Like I block one. I block it on my phone, so I never know when my doctor calls me. This way, a little bit more modern. I prefer that way. And Roland is going to receive notification in his private email with a link to join the remote monitoring session with the nurse in this case. And this is under the hood is using the technology of Teams communications and communication services in Azure. So let's roll over to the home of Roland.
Hello there, I'm at home. I'm experiencing the remote patient monitoring scenario here. I have logged into my telehealth portal and in response to what the nurse has sent me, I'll be waiting for my consultation to begin.
On my side, I actually see him waiting in the portal, and I'm going to join it from my Teams client and allow Roland to join my session. Hey, Roland, how are you?
Hello, nurse.
You have received the kit, and looks like you have done a test this morning for your blood pressure. It's not too bad, 128/76. Why don't we do the pulse and oxygen test as well?
Okay, nurse, I've put my finger into the pulse oximeter, and you should be seeing some readings that I got on my tablet appear for you.
Yes, just show it to me on the screen, please. Great. Yep, I can see your results. Okay. Any other issues that any other questions that you have? And like the doctor said, you will do this every morning.
Yes, I've been doing this every morning. I kind of noticed I've been having some weight gain suddenly, so I have to, I want to ask the doctor about that.
let me check if the doctor is available. And notice, folks, I am just staying in Microsoft Teams. So all the capabilities of Microsoft Teams is still there. If you're familiar, I can look up availability of people. I can see that Todd is available, and I can request the doctor to join. Because the doctors are always on call, right? 24/7.
That's right. That's what we're here for. Hey there, Lieutenant Roland. How's things going?
Hello, doctor. Things are going well. It's improving. The meds are working, and I've been checking in on my blood pressure and pulse rate every morning that your nurse has just checked on. I do have a question.
I didn't see that. That's good.
Yeah, that's so it's working well. The question I have is about this weight gain I've gotten all of a sudden from, I don't know what, maybe the meds.
Yeah, that can happen a little bit. I'm also guessing you probably haven't been as active as usual, given that, you know, your arms being a bit sore, etc. But yeah, that can be a side effect. Is it a bit of a concern for you?
Well, you know, I'm trying to get ready for my triathlon in a couple of months, so you know, every ounce counts.
Every ounce counts. Think of it as you're building up a store of energy, but we can certainly do some work around that one for you, Roland. Tell me, Ladonna, did we send the scale out as well as part of the Cloud DX remote monitoring?
Yeah, per your order, it was the full kit.
Okay, so that means you should be doing blood pressure. You would have got a scale there. You know what I want you to do, Roland? I want you to, well, we'll add this into the order if we can, Ladonna. If you can jump on the scale first thing in the morning when you wake up, so, you know, just when you get up, before you have anything to eat or anything like that, just jump on that scale, do a quick reading. It should just, I believe it's like completely transparent and automatic. And then do me a reading at the end of the day as well. I'd like to be able to get the comparison points as we go through it, if that's okay.
Okay.
That sounds excellent. So I'm hoping that things are getting better, and I look forward to seeing you in the future and keep on that training, moving up. Thanks very much, Roland. I'm going to jump to my next patient. I'll catch you later. And don't forget, Ladonna, we have training this afternoon for the team, and we've got a new hire, I believe. Excellent. I'll catch you all later.
Thanks, doctor. Thanks, nurse.
So as you have seen, I am doing all my work within the Teams environment. So Teams is not just a communication vehicle, it's actually extendable with applications. So I don't have to jump around between many different screens. On average, a lot of medical facilities have 6 to 12 different portals they have to copy and paste and jump around between, and sometimes it's even more. In this case, we brought everything into one environment, but it's not just patient care. It also brings in my learning experience. I'm going to get ready to go to my training. It's also bringing, and this is, if you haven't heard, it's called Viva Engage. It's also bringing my community. So if I'm a new person or if I'm an expert in particular topic, I can use Viva Engage to participate in communication about my company or advice to others or get advice from others exactly in the same place. So it's both communication vehicle, my work vehicle and patient care, as well as my personal experience within the same environment. And that is the idea. It's not just the communication that most companies are looking at Teams like. It's really a platform that can bring everything together. So what I'm going to do is I'm going to take a little break and I'm going to go to my training facility, and that will be our last scene. And we're going to disconnect the screen. Just give us a second to reconnect it to the training facility, and I will go there. So 710 87719. So give us a second to connect the HoloLens. There we go.
Excellent. So thank you very much, everybody, and welcome to this afternoon's training. So, Nurse Lozano, look who we've just hired.
Hey, Roland, haven't seen you in a while.
So Roland has joined our team, and he's actually one of our new EMTs who will be working with the hospital. I believe you enjoyed the treatment so much you decided to join us.
Absolutely.
Excellent. So here at Memorial, what we want to be able to do is make sure you guys all keep up to speed, okay? Now, the thing is, we want to make it as realistic as possible, and so we've been making some investments by leveraging HoloLens. So what we're actually going to do now is participate in a shared classroom experience. So sitting in front of me, we have our new dummy, and this is using CAE Healthcare. Now, what they've actually been able to do is build an amazing experience that takes advantage of all of the capabilities inside of the HoloLens so we can have the best possible experience. So I'm bringing you all together, and as you can see, you've all been connected in now. And if you look behind you, you can see up there the view from the ultrasound one, because what I want to do today is we're going to do some training around exploring how to use this to look for heart abnormalities or abnormal readings, okay? Now, when I first start this off, you can see on the main view here, we can actually see the 3D slice that's being generated, and of course we can see what we'd be having a look at with the raw reading, but I don't know about you guys, a little bit difficult to see what's going on here, especially when using this on top of the dummy. So let's have a closer look here. And what we're able to do instead now is actually project onto here, and you can actually see here's the heart, and look at how we changed the slice to be able to have a look at the way that the different chambers are behaving. And you can even see here from this angle, we can actually see how the different valves are performing, okay? So what I want you to all do is, using the tools here, we're going to spend a bit of time exploring how you can actually best do this. So you know what, Roland, you're our new employee, so you get to come in first. So bring this down onto here. Now, I want you to slide forward a little bit there, and as you can see, as you move forward, you're cutting through more of the heart right to the bottom there, okay? So much better way of learning, I think, when we're having a look at what's going on and being able to work with the anatomy that sits underneath. So with that in mind, I know that we have certainly been going through quite a lot of information here. So let's just jump back for 1 second and let me see if I can bring this up. And I want to just share this briefly here just to loop back and finish off. So thank you, first of all, to Alex and to Phil. And behind a 84-inch Surface Hub that we wheeled in on the last minute is Andreas, one of my other wonderful colleagues out of the New York MTC, one of our architects, who has been acting as our camera person, switching on a dime. So huge kudos to him as well with that. We've gone through and explored and experienced 4 different quadrants within healthcare, being able to enhance the engagement by connecting and bringing passengers, patients in where they need to be during our care cycle, coordinating and working together, building better clinician experiences, and of course, increasing productivity and providing better insights for how we're actually performing overall. With that in mind, I wanted to say thank you for everybody for spending time with us. And I wanted just to see if we did have any questions that were in the chat, and we'll hear the disembodied voice of Andreas.
Yes, Stephen. Someone asked if you were a real doctor.
Am I a real doctor? Oh, no. That would be your worst nightmare. But funnily enough, they have given me access in here to some surgical instruments, so be afraid. But no, I am not a real doctor. I will say, though, my other half is a nurse, so I have learnt quite a bit over the years through osmosis, and it scares me at times, but no.
Speaking of equipment, someone asked what type of tool is being used to identify the anatomy?
The tool that was being used here, this is an ultrasound probe in this particular case. It's using an intelligent mannequin here that is connected to a PC. The PC is then using a genuine styled probe, and it is actually working in real time to feed the data back and through. This comes from CAE Education. They also have mannequins that allow you to go off and deal with obstetrics. We also have mannequins with them to be able to deal with pulmonary and also cardiac as well. So they actually have a wide variety of training tools that they enhance using the HoloLens to provide that immersive experience.
Another question from Lynn, can you comment on any customers who have deployed this technology, especially the HoloLens tech?
So there are a large number of customers in healthcare who've been leveraging HoloLens from a wide variety of use cases, starting with something simple by using remote assist with HoloLens to enable more skilled or longer term clinicians to be able to share their insights with other individuals in different locations. We've actually used the HoloLens in conflict zones, etc., where we were able to take the skills of a physician out and multiply their capabilities with a wide variety of people. So that's just one place that we've started. We've been using the CAE tools, and there's a case study on Microsoft.com with a number of different customers. Plus, we also have Case Western University that is leveraging the HoloLens on a daily basis with their students to teach things like anatomy. Given the limited access to cadavers in the marketplace these days and the expense that is associated with them, by using holoanatomy, they're able to take students in a shared experience to be able to have a look at anatomy in a far more effective way. And that's actually something that's becoming available from Case Western to other organizations. There are actually a large number of HoloLens-focused healthcare solutions that you can find on Microsoft.com/HoloLens and also in the healthcare industry portal as well. So lots of different areas that this is being used.
Few questions, but they are leading to where can they find out more information about the platform?
To find out more information about the Microsoft Cloud for Healthcare, there's a couple of different ways. First off, I have to do a shout out and a bit of advertising for the team that we all work for, the Microsoft Technology Centers. We do regular briefings with our customers, which are aligned to saying, how can the Cloud for Healthcare resolve your particular organization's needs? So that's one place. Of course, on Microsoft.com or inside of Bing, if you just do a search for the Cloud for Healthcare, we come up in the search results, and there is a dedicated portal that takes you through all of the pieces, whether it be provider focused, whether it be around health, life sciences, or around the insurance aspects that we have in place as well. So tremendous information there. Also reach out to your teams, so whether it's your account team or one of your contacts within Microsoft, and I'm sure we can arrange for a briefing there. There's some great videos as part of the Cloud for Healthcare portal that can quickly walk you through the environment. It is large. There is technologies in Azure, in M365, dedicated technologies inside of the Power Platform, and we built a lot of this on top of the Dataverse combined with the enhanced capabilities that you saw leveraging the Dynamics 365 platform as well. So there are a lot of components that you can pick and choose from as well to be able to deliver these. And of course, as I mentioned, we recently acquired Nuance, and you'll see more of their capabilities become more broadly available as well.
And I want to enhance one point that Stephen was saying. There are solutions that Microsoft has pre-built that are part of Cloud for Cloud for Healthcare. And there are partners, as you have seen, that integrate with Cloud and extend Cloud for Healthcare. But don't necessarily limit yourself to that. it's built on top of the entire cloud platform that we have, from all components. And also don't limit yourself to just cloud for healthcare. For example, there's a lot of IoT use cases in tracking kids, tracking patients, variety of scenarios like this. There's a really, really cool set of solutions in cloud for manufacturing for IoT types of activities. So it's really a component architecture that, as you figure out the specific business need, we can pick the starting points and add-on solutions from various industry clouds that we have. So it's really an open-end architecture that is built on the same principles that can be reused for different business purposes.
So Alex, I feel compelled to add then that the Microsoft Cloud for Health, with its FHIR data interoperability, and that roadmap is really pivotal to be the foundation of how we interconnect all these modular ISVs, partners, and Microsoft first-party components to deliver the best patient experience possible.
So with that, I know we have run over time a little bit, but to be fair, any of my colleagues will tell you I'm notorious for that. So you know what? I was living up to the standards on that one. Everybody, thank you very much for joining us. We appreciate the time that you've spent with us, and we hope you got inspired by some of the amazing things that we see here. Come to an MTC. We would love to be able to help you figure out how to take all of these things so that you can deliver better solutions for your customers and you can have a far more enhanced experience moving forward. So with that in mind, we hope that you all enjoy Ignite, and we look forward to seeing you in the future. Thank you.